Hi, I'm Dr. Kelly Starrett with H-Wave. Today we're talking about how to use the low frequency setting on your H-Wave so that we can get non-threatening input into the back. Now remember, our goals here with low frequency is to have non-threatening movement kind of in the body so the brain starts to recognize the spine as less of a threat. We also are trying to improve blood flow. Can we get muscle contraction to drive and dump lymphatics and bring groceries in while taking garbage out? So one of the problems when we have back pain or discomfort in the back is that we tend to not move enough to actually get the normal sort of waste cycling to happen in the tissues around the spine. So what we end up with is sometimes low movement, sort of higher ischemic, lower oxygen environments, which can be noxious. One of the advantages of trying to improve blood flow in any system is we see enhanced healing, and oftentimes just getting that movement in is enough for the brain to say, hey, look at all these things happening. It's non-threatening, it's okay. So we've got Mag set up on her stomach here, but ultimately remember, the goal anytime you're using low frequency on a body is to find a position where you can get good relaxing and you're not fighting the contraction. We're trying to stimulate and create a muscle contraction, but if you're active or guarding, that means that that's going to be less effective. So in this situation, Margaret has her feet up, but you could lay on your back, you could be sitting in your favorite chair, whatever position gives you comfort. Now what we're going to do here is be thinking, because I'm trying to get the musculature and the region to contract, I'm going to typically set up a pad placement in an area sort of where, hey, I've got soreness in this area, I'm going to try to go above and below it, sandwich it, but I'm going to go ahead and stay on one side with one set of leads. And that means that I'm just going to get kind of contraction on this side, and then I'll get a kind of corresponding contraction on this side. Now, you can absolutely play with your pad placement. You could go side to side, you can cross. What you'll find is that your special concoction or special organization of your pads is going to be appropriate for you, and we trust you. That's okay. The bottom line is that we're trying to get as much muscle tissue in the area of that we're trying to control or trying to affect as possible. So feel free to move pads in and out. Even go ahead and cross the spine is absolutely okay. So now we've got just a couple setups here. And let's say that Mags is having some low back, general low back fatigue or low back ache here or a specific spot. Ideally, the magic is, hey, I've used high frequency to give myself some pain relief. Now I immediately can go to low frequency. We even have good success working high frequency for an hour and simultaneously low frequency to get movement, so that it's a way of getting the brain to be comfortable with a lot of movement. But in this situation, we've got Mag set up just for some low frequency. So I'm going to turn the machine on. I'm going to select low frequency. But as always, it's the person receiving the treatment who's in control. So I'm going to hand this to Margaret. And what I'm going to try to remind her is not to just extend, but can she find a comfortable position? And then she's going to dial this up until she gets a comfortable muscle contraction. The first time you do this, it can be a little bit unsettling because now your body is moving without sort of conscious control. But the idea here is that she's going to turn this up until she gets a solid contraction in the area that feels comfortable. Now, it may be higher or lower on one side. Don't even necessarily look at the numbers. Just dial the dial up until you feel like you get the contraction that feels appropriate. So even if you're very sensitized and only having a little bit of movement, that's okay. What we're really after here is any input that causes a contraction is going to be a net positive to the system. So you don't have to get the strongest contraction that you can tolerate. Find something that's comfortable. Our minimum threshold is really thinking about, hey, if I was going to go for a walk, a 20-minute walk would be great. And ideally, if I had the opportunity to do this throughout the day, I would do a little bit in the morning, I would do a little bit midday if I could, or I'd do it in the evening. And at the very least, morning and evening. But there's really, what you'll find is that there's no upper limit to how much muscle contraction you can have. And so the idea here is that we can get tons and tons of cycles. 2 contractions a second for many, many minutes, and that's like going for a 2-hour walk or a 3-hour bike ride. It's actually impossible to get that amount of movement in the spine sort of realistically every day. So what's happening here is that Margaret has this set up. She's getting a muscle contraction that feels appropriate. I'm feeling it, and you can see my hand is jumping here, right? And she is in control and it says, hey, I have enough. Margaret doesn't have anything going on with her back. In real life, can you dial those up and get us a solid kind of pump that we can see? Really dial it up, boom. Now you can start to see it's pulling on her rib cage. You can see a large muscle contraction happening. We don't need this, but if it feels tolerable, a strong contraction is the only thing we're after. If it turns out that, go ahead and dial that down a little bit, you've dialed it all the way up, you're not getting what you want, you could always add a little bit of the aloe gel, or feel free to move the pads around. We typically don't have a problem with muscle contraction in and around the spine. Remember also that we're not going after a single muscle, we're going after the region. We've got multifidi and rotatories and even quadratus lumborum. There's a whole lot of musculature in the area. What we're thinking is, hey, the body contracts in a system, and when we can recruit all of that musculature, we're going to see improved movement tolerance. The reason we're doing this is to help us decongest, bring in the groceries, take out the garbage, and simultaneously get a ton of movement into the spine that replicates what our bodies would be doing if we're moving. The idea ultimately is to have us move and feel better so that we can move through our environment. Lastly, don't be afraid to feel like, hey, I can't get up. You absolutely could sit up, you could do the dishes, you could walk, you could watch TV, and what will happen is that your own muscle contraction will override it. But when we're pumping with low frequency, the name of the game is to find a comfortable contraction and then integrate that into as many daily activities as we can. If you can lay down, great. If you need to go about your life, also fantastic. But the bottom line is low frequency is amazing.